Welcome all to the session 5 on human development for the MRCPsych paper revision marathon. I study MRCPsych. Myself, Dr. Rojina and your mentor, study MRCPsych and a consultant psychiatrist. So let me try to give you a brief overview of what we will be discussing under today's lecture. So our lecture is on human development and we will divide it into 5 pillars. So we will begin with attachment theory and we will look at the psychoanalytical framework. Then we will move on to the cognitive and moral theories of development by Piaget and Colbert. We will further discuss the socio-environmental factors like language and parenting. Then we will move on to the lifespan psychology and we will look at the key neurodevelopmental disorders. So let's begin with our first section, that is attachment theory. I hope all of you are familiar with attachment theory. It is proposed by John Bowlby. He defined attachment as a specific dyadic emotional bond between an infant and the infant's primary caregiver. So attachment, I want to highlight here that attachment is innate and it is adaptive. So it's innate in the sense that infants need attachment, need to form relationship between or with their caregivers for the survival. And this primary caregiver is usually the mother, but it may not necessarily be the mother always. So a key concept that Bowlby introduced here is monotropy. What is monotropy? So as I mentioned, the infants have a tendency to attach primarily to one figure, whom Bowlby called as primary attachment figure. And this tendency or this bias of the child towards a primary attachment figure or a principal attachment figure is what we call as monotropy. Now he also gave the concept of internal working model. So what is this? So internal working model simply means that Bowlby concluded that with the quality of attachment, it is reflected on the quality of future relationships. For example, a child or an infant who has a secure attachment style will become a socially competent adult. So internal working model just proposes that the quality of the attachment that is formed in the early childhood reflects our adult relationships. Maternal deprivation hypothesis also proposed by Bowlby, but we will see that in the coming slides. Now, Bowlby also told that attachment develops in phases. So these are the phases that are discussed or discussed by Bowlby, which include the pre-attachment phase, which develops from birth to around 6 weeks of infancy. So here what happens? Here the child or the infant usually orients towards the mother. The infant may follow the mother with its eye movements or may recognize the mother's voice. But the infant would be usually comfortable around strangers in this period. So this is pre-attachment phase where there is no complete attachment. The second phase is attachment in making. This is from 6 weeks to around 6 to 8 months. So here what happens? Here the infant may show different approaches or different responses towards familiar figures and strangers. And he develops a tendency, the infant he or she may develop a tendency to the principal attachment figure. Then the third phase is a clear-cut attachment phase that is from around 6 to 8 months to 18 to 24 months. So this is where the infant forms infant forms attachment with the principal attachment figure or the primary caregiver. Now the final stage is the formation of reciprocal attachment that is from 18 to 24 months and so on. So here the infant learns that or the child learns that the principal attachment figure or the primary caregiver, though the primary caregiver is out of sight, they may come back. So the infant starts to learn that though the primary caregiver is not present at the moment, their anxiety would resolve because they know that the caregiver may come back. So we need to also know here about what is the difference between stranger and separation anxiety. So stranger anxiety, like as I mentioned, the infants, like in the early or the pre-attachment phase, they are comfortable around strangers. But around 8 months, they develop anxiety or around the strangers. It is what we call a stranger anxiety. But what is separation anxiety? Separation anxiety is seen when the infant is separated from the primary caregiver or the principal attachment figure. The infant shows signs of distress. So the separation anxiety is usually seen around 10 to 18 months, and it often disappears by around 3 years. Moving on. So you all might understand what was depicted in this picture. So this is the famous Harry Harlow's work with young rhesus monkeys. So Harry Harlow, what he did, he conducted an experiment in young rhesus monkeys where the monkeys were separated from their birth mothers within few hours of birth, and the monkeys were given two options: a wire mother which provided food, and a cloth mother or with a soft cloth which provided comfort but no food. So what he observed in this experiment, he observed that the monkeys significantly preferred cloth mother over the wire mother. So his work revolutionized this field of attachment by proving that contact comfort is more essential for bonding than the provision of food. Now, coming to the strange situation experiment by Mary Ainsworth. So Mary Ainsworth is a psychologist who developed the strange situation experiment to objectively measure the attachment quality. So what is this experiment? I'll take you to the next slide to better understand that. So this is what is a strange situation experiment. There are a total of 7 steps, and in this 7 steps there are 2 situations of reunion and 2 situations of separation. So let me clarify further simply. So firstly, the child is with the parent, and the child is with the parent comfortably. Then a stranger comes, and then we observe, Mary Ainsworth observed how the reaction is. Then what happens? The parent leaves and the child is with the stranger again. Then the parent comes back and the stranger leaves. Then what happens? The parent again leaves and the child is left alone. And the stranger comes, and Mary Ainsworth notices how the interaction is with the stranger, and then the stranger leaves at the same time, parent comes back. So based on this experiment, she identified 3 types of attachment styles. One is secure attachment style, the second one is avoidant attachment style, and ambivalent attachment style. This is based on how the children reacted when they saw the primary attachment figure or the parent or the mother. So children who were securely attached, they used their mother as a secure base for exploration, and they were easily comforted upon the mother's return. So this is the most common type of attachment style, that is secure attachment. Now, avoidant attachment style, and this is also called as anxious avoidant. So what happened with these children? These children, they showed little distress when they were separated from the mother, and when the mother returns, they avoid the care as well, and they are easily comforted by the strangers. The third type is ambivalent. This is also called as the anxious ambivalent or anxious resistant type. So here what happened? Here the children, they were highly distressed by separation, but when the mother came back, it was difficult to see them. They resisted the contact, or they showed angry response on reunion. And the fourth style was added by a psychologist called Mary Mean. So don't confuse between Mary Ainsworth and Mary Mean. So the fourth style, that is the disorganized attachment style, was added by Mary Mean, which is a combination of both avoidant and ambivalent styles. So you also need to remember the percentages of each of these styles of attachment. The most common, as I mentioned, is a secure attachment style that is approximately around 65%. Also, it is crucial to remember that the attachment style, it's a function of the caregiver sensitivity. It is not a function of the child's temperament. So we have already discussed this. Please, if you're not familiar with the strange situation experiment, please go through it, what it is. So let me highlight, there are 7 situations. There are 7 steps in the strange situation experiment with 2 reunions and 2 separations. Now, coming to the attachment pattern. So this table correlates the behaviors that are observed in the strange situation experiment with long-term social outcomes. So securely attached individuals or infants, they tend to be socially competent adults, and they have good peer relationships in the later childhood and adulthood. Whereas avoidant children or children who showed avoidant attachment style, they become emotionally distant because they have learned that their distress doesn't elicit a helpful response from the caregiver. When we come to ambivalent attachment style, these children, they are often clingy or they are often anxious because the caregiver's responses were inconsistent. And the final pattern is the disorganized pattern. This is the most clinically concerning pattern because this is a strong marker for maltreatment, abuse, or neglect, and it is a precursor for later psychiatric problems in later life, like dissociative experiences or personality difficulties, etc. So, disorganized attachment style is most commonly associated with abuse, neglect, and later psychopathology. Moving on. So, I have discussed about the stages that were proposed by Bowlby. Now, Bowlby also, I've also mentioned about the concept of monotropy that was proposed by Bowlby, where he described the bias of the child towards a primary caregiver or the principal attachment figure. But the work of Schaffer and Emerson is different. So, what is the difference with Bowlby's work? Let's see that. So, Schaffer and Emerson, they showed that attachment develops in predictable phases and it is often polytropic. That is, there are multiple attachments than monotropic when we compare it with Bowlby. So these are the stages that they develop. First is the asocial stage, that's around 0 to 6 weeks. Then there is indiscriminate attachment, that is from 6 weeks to 7 months. Then there is specific attachment, usually towards a primary attachment figure, usually the mother. Then there is multiple attachment from around 10 months of age to other caregivers like the parents, or like the father, the siblings, or others. This is the highlight of this theory, that the stage that there is multiple attachments according to Schaffer and Emerson. And moving on. Now, what is this concept of maternal deprivation versus privation? So we need to distinguish between both. So Bowlby originally proposed the maternal deprivation hypothesis based on the 44T study in 1944 and suggested that breaking an existing bond, so there is already a bond or attachment formed, and breaking of this existing bond results in affectionless psychopathy. But Rutter proposed something different. Rutter mentioned or highlighted the importance of privation. That is, attachment is never formed at all. So, deprivation proposed by Bowlby is that the bond that is formed is broken or there is an interruption. Whereas privation proposed by Rutter states that there is no attachment formed at all or no bond formed at all. So, Rutter clarified that privation, that is never forming a bond at all, is more devastating to development than deprivation. And Rutter's theory of privation was developed by his study on the Romanian orphans, which showed that the children, so he based his studies on orphans, where it showed that children adopted after the age of 4 to 8 months often struggle with indiscriminate attachment. So later the adoption is associated with worse outcomes and developmental retardation, whereas those adopted before the age of 6 months, they showed significant recovery. So Michael Rutter is the one who made a vital distinction between deprivation and privation. So moving on. So here I have tried to summarize the difference between the two studies. So I told you that the maternal deprivation is based on Bowlby's studies, a study that is called the 44T study. What he did here, he compared 44 juvenile Ts with 44 controls. So he investigated whether early maternal separation was linked to juvenile delinquency. So this out of the 44 Ts, 14 of them had affectionless psychopathy, and out of this, 12 of them had prolonged maternal separation before the age of 5 years. So he concluded that maternal deprivation increases the risk of affectionless psychopathy and delinquency. But the limitation of the study is that there's a retrospective study and there is no causality that is implied in the study. Whereas Rutgers study on Romanian orphans, like I told you, he studied the orphans who were adopted into the UK families after severe institutional privation. So the infants were adopted before 6 months. They had near normal cognitive, emotional, and social development, but later adoption was associated with worse outcomes. So the key take-home message from the deprivation versus privation is that privation is more grave when we compare with deprivation. Now, coming to the concept of imprinting and early bonding. So what is ethology? So, ethology is a biological study of animal behavior, and this person is Conrad Lorenz, who is known as the father of ethology. He famously described the phenomenon of imprinting, that is a primitive form of learning during a critical period where a young animal follows the first moving object that it sees. So he based his studies on greylag goose, and he told that this imprinting occurs in a critical period, usually within a few hours after the birth or after the egg hatches. The goose will follow the first moving object that it sees. So there are 3 parts in imprinting. One is the following response. The first part is the following response, and after that, the goose will develop an attachment to the first moving object that it sees. And the third phase is where once the geese mature, they develop a sexual preference to the object that it attaches. So there are certain characteristic properties of imprinting. So it is a very rapid process. It is an irreversible bonding, and it is unreinforced. That is, there is no reinforcer that is needed for the response to occur, and it occurs during a critical period. That is usually within hours of the egg hatching. Now, we need to know the difference between the critical and sensitive periods. So these are time-limited windows. The critical period I have already discussed under imprinting. It was proposed by Lawrence. So the goslings imprint on the first moving object usually within 12 to 17 hours after hatching. But what is sensitive period? So sensitive period was described by Bowlby in humans. So in humans, we mentioned sensitive period instead of critical period. Here, the time is not rigid. So this is often referred as the best time or optimal time, but recovery is still possible, even if the person skipped this time. Moving on. Now let's see the major psychoanalytical theories of development, beginning with Sigmund Freud and the later theorists who expanded his ideas. So as we all know, Sigmund Freud proposed that personality develops through 5 psychosexual stages, and fixations can occur in each of these psychosexual stages, leading to different conditions. We will again see this psychosexual stages in the coming slides, so I'm not explaining it further here. The next is Margaret Marler. So she proposes separation individuation theory. So she described basically how a child develops a sense of identity that is independent of the child's mother through a theory called as separation individuation. So her stages include the stage of normal autism, that is from around birth to around approximately 2 months. Then there is a stage of symbiosis, and that is from 2 to 5 months. And then there is the individuation phase, where the child recognizes themselves as independent from the mother. And there are also subphases in the individuation phase, like rapprochement, differentiation, etc. You can go through this. So rapprochement is where the child oscillates between autonomy and dependence. Now coming to the third theory, that is Klein, she proposed the object relations theory. So Melanie Klein emphasized the object relations of the infant, focusing on the transition from paranoid schizoid position, where the infant usually splits the world or the experiences into either good or bad objects. So So that there is a transition from this position, that is a paranoid schizoid position, to the depressive position, where the infant realizes that the objects are unified. So the infant realizes the object as a whole, that is good and bad are aspects belonging to the same object or the same experience, leading to more integrated relations. Now, let's try to answer this question. First question is, Harlow's experiment with rhesus monkeys demonstrated the importance of, these are the options. So you can try to look for the answer. So let's look at the options one by one. So Harlow's experiment with rhesus monkeys demonstrated the importance of feeding for attachment. No, it's opposite. Operant conditioning, it was proposed by Skinner. Imprinting, we know, by Lawrence. Stranger anxiety, it is an entirely different concept. So Harlow's experiment with rhesus monkeys demonstrated the importance of contact comfort over feeding. That is, the monkeys prefer the clothed mother over the wired mother who provided food. And the next question is, the strain situation procedure was developed by Mary Ainsworth. So the key people that you need to know in the theory of attachment, Bowlby, who proposed attachment theory. Mary Ainsworth is associated with strain situation experiment. Then we have Mary May, who added the fourth style of attachment, that is the disorganized attachment style. And Harry Harlow, we already discussed the experiment in Harlow's monkeys or the rhesus monkeys. Lawrence proposed the idea of imprinting. Then Margaret Marler, we already discussed, gave the theory of separation individuation. So the answers are, okay, infant monkeys preferred soft clothed surrogate for comfort over a wired mother who provided food. Moving on, Ainsworth proposed the strain situation experiment, and May added the fourth type, that is a disorganized type, as I already discussed. Now, I am giving you all a scenario. In the strain situation, the infant shows little distress when the mother leaves, but when the mother comes back, the infant ignores her, seeming indifferent. So what can be this type of attachment? Can anyone guess? Okay. So the answer to this is insecure avoidant attachment. So there is minimal separation on distress and avoidance of the caregiver on reunion. Whereas in anxious, ambivalent or resistant type, the child will be very distressed, but when the mother comes back, the child cannot be seated. Now, moving to the second section of today's lecture. So we are looking at the developmental stages, and there are four main developmental models that all of you need to know for this exam. One is the Freud psychosexual stages of the development. Then Erickson's psychosocial theory of development. Then Jean Piaget's cognitive stages of development. And then Lawrence Goldberg's theory of moral development. So let's try to look at them one by one. Beginning with Jean Piaget. So Jean Piaget is a pioneer of genetic epistemology. What did he do? He argued that the children's thinking develops through invariant hierarchical stages. So his Jean Piaget's cognitive stages is a cornerstone of cognitive development. He viewed children as active scientists who always build schemas or to understand the world better. So he described around 4 stages. Each of the 4 stages are qualitatively different. For example, a child cannot move from the pre-operational to the concrete operational stage until they have mastered the concept of conservation. So let's try to look at the stages one by one. Okay, so like I told, there are 4 universal stages that Jean Piaget proposed, with each stage that builds the previous one. Builds on the previous one. So each stage builds on the previous one. So the first stage is a sensory motor stage, that is from birth to around 2 years of age. So here the infant learns through the senses and through motor activities. They progress from simple reflexes to intentional actions and gradually develop object permanence. That is the understanding that the object can exist or can continue to exist even when it's out of their sight. Then the second stage is pre-operational stage, that is from around 2 to 7 years. Here the child develops language and symbolic thinking, but the thinking is still egocentric and intuitive than logical. They often show animistic thinking, that is, attributing life to inanimate objects. And they show magical thinking, where unrelated events are believed to cause each other. Then the third stage is, so I have to highlight, egocentricity is a part of pre-operational stage, and egocentricity is classically demonstrated by the experiment, that is a 3-mountain task. If you have not heard of this, please have a read about what is 3-mountain task. Now the third stage is concrete operational stage, that is from 7 to 11 years. Here the thinking becomes logical, but only for concrete situations. So here the children develop conservation, reversibility, classification and seriation, and begin to understand another person's perspective. And this in turn produces the egocentricity. So egocentricity is where the child cannot understand the other person's perspective. So this is reduced in the concrete operational stage. The final stage is the formal operational stage, that is from 11 years and onwards. So here the adolescents develop the ability to think abstractly and hypothetically. They can use deductive reasoning, solve complex problems systematically, and consider multiple possibilities before reaching any conclusion. So please go through the 4 stages one by one. MCQs, this is a very high topic for paper A, and different MCQs can come testing each of the stages. So please revise this the day before your exam. Now, as I told, so Jean Piaget, he viewed children as active scientists. So what are the mechanisms to understand the stages of cognitive development? So he proposed 3 things. One is schemas. So learning equals to schemas. Schemas are simply basic building blocks of knowledge. Then what is assimilation? Assimilation is fitting the new information into the existing schema, whereas accommodation is changing the schema to fit into the new info. For example, I will give you an example to better understand this. Suppose a child sees a dog, the infant sees a dog. So he may build a schema that this dog has 4 legs. So he builds a schema, everything that has 4 legs is a dog. Now the child again sees a cat. So what happens? The child sees that the cat has 4 legs, but it doesn't match with the schema that dogs have 4 legs, because the cat looks different from the dog. So he has to change the schema to fit into the cat. So the child will change the schema to both cats and dogs may have 4 legs, but the dog barks. And for the exam, you need to pair the hallmark with the stage. So object permanence, that is knowing a hidden toe still exists, is the hallmark of sensory motor stage. Egocentrism, that is the inability to see others' perspective, is a hallmark of pre-operational stage. As I mentioned, read about the 3 mountain stars. And conservation, that is grasping that the quantity stays the same despite the changes in its appearance, defines a concrete operational stage. A common critic to Piaget's task were that this were considered to be very complex, and children may actually possess these abilities earlier than he proposed. So, coming to the theory by Vygotsky. So, unlike Piaget, who saw development as an individual journey, Vygotsky argued that cognition is a social process. So, he introduced the concept of, or the term that is called a zone of proximal development. That is the difference between what a child can do alone and what they can do with help. So what is the difference between what a child can do alone versus with help? So the assistance is provided by the teacher or parent is called scaffolding. So this is gradually removed. This assistance is gradually removed as a child masters his task. So this emphasizes the idea of collaborative learning, and this theory proposed by Vygotsky is said to be highly influential in educational psychology. So you need to remember these terms: the zone of proximal development, that is a gap between the actual and potential ability that is attained with help, and what is scaffolding. So what are the differences between Piaget's and Vygotsky's theory? So both of them believe that children actively construct knowledge, but they differ in how development occurs. So Piaget believes that cognitive development occurs through fixed universal stages, with children learning independently by exploring the environment. So children learn independently by exploring the environment, but Vygotsky proposed that they learn through social interaction. And Piaget also emphasized biological maturation, discovery learning, the process of assimilation, accommodation. Whereas Vygotsky told that learning occurs through guidance from a knowledgeable others, it's a parent, teacher, or a peer. So in Piaget's theory, the key concept is schema, whereas in Vygotsky's theory, it is on a proximal development and scaffolding. So here learning is stage bound. He described fixed universal stages, whereas according to Vygotsky, it is culturally mediated. Moving on, coming to Lawrence Goldberg. So Lawrence Goldberg gave the stages of moral development. So he used the classical experiment that is called as a Haynes dilemma. I hope all of you are familiar with Haynes dilemma. If not, I will briefly tell about this. So here a woman is dying from cancer, and this is her husband Haynes. So there is a pharmacist who developed a drug that can save the woman's life, but the pharmacist is charging around 10 times the actual price of the drug. The husband Haynes cannot afford to pay the price, and he requests the pharmacist that he will pay it later, or please provide it in a cheap rate. I will pay it later, but the pharmacist disagrees. So the husband steals the drug. So the question here is whether or should Haynes steal the drug? Why or why not? So Goldberg's theory of moral development, or the stages of moral development, it has a total of 6 stages that are divided into 3 levels. So it's based on the Haynes dilemma. So there is a pre-conventional level, it is from 0 to 9 years, and there is a conventional level from 9 to 20 years, and post-conventional level from 20 and onwards. So most children, they operate at the pre-conventional level, where right and wrong are defined by rewards and punishments. So first is the children may focus on the direct consequence of action. So a child in the pre-conventional stage, when put forth with the Haynes dilemma, he may answer that the husband shouldn't steal a drug because the police may catch him, or he may be punished. So this is the obedience and punishment stage. But the same child in the pre-conventional level, in the second stage, may tell that the husband should steal a drug because he'll get his wife back. So there is a reward. So the second stage is focused on self-interest orientation or instrumental relativist orientation, because aiming at a reward. The right behavior is defined by what is the individual's own interest. Now coming to the second level, that is a conventional level, that is around 9 to 20 years. So in this level, the child or the individual may answer that Haynes or the husband shouldn't steal because he may appear as a thief in front of others. Or it is against the law. So, individual may answer that Haynes must steal because then only he will become a good husband. Otherwise, he is not a good husband. So, the levels are interpersonal accord and conformity stage, that is focus on how the individual will appear to others, and then loyalty to law and order. That is. It is authority and social order obedience driven. That is what is lawful is judged to be morally right. So here the individual may answer that it is against the law, so Haynes shouldn't steal. So the individual may answer that he should be a good husband. If he needs to be a good husband, he should steal. Now coming to the third level, that is a post-conventional stage. So here the individual may answer that Haynes should steal because the right to leave is more important than any other law. So the wife has a right to leave, and it is more important than any other law. And whereas in the final stage, the individual may answer that shouldn't steal, though the situation is tragic, he shouldn't steal because it breaks the universal ethical principles. So, most adults usually resign at the conventional stage or conventional level where the morality is defined by social rules and maintaining order. Only about 15% of the population reaches the post-conventional level where the universal ethical principles supersede the written laws. So, I want to highlight here again that only 15% of the individuals reach the post-conventional level. So, there are total of 6 stages according to Kohlberg, that is divided into 3 levels, and only 15% enter the post-conventional level. What are the critics of Kohlberg? So one of the major critics of Kohlberg's theory is that it places high value on individualism that is not universally accepted because it is more biased towards the Western culture. And his theory was also criticized as sexist because his theory or his experiment only involved boys. Now, coming to the next theory, that is by Erik Erikson. So, Erik Erikson proposed the psychosocial stages of development. He proposed a lifespan model, and this is very high yield for paper A. So, here I need all of you to focus that each stage has a crisis and a resulting virtue. So, here I want to add that pay close attention to adolescence, where the crisis is identity versus role confusion, and the virtue is fidelity. So, identity versus role confusion in adolescence. In middle adulthood, the focus is generativity versus stagnation, and the virtue is care. And the late adulthood involves a retrospective view of one's life, leading to ego integrity versus ego despair. So let's try to see the stages one by one. So he proposed 8 stages. Remember, there are 8 stages where each phase has a core conflict. The conflict is between trust and mistrust in stage 1, and associated virtue is hope. So infancy it is trust versus mistrust. In toddler stage it is autonomy versus shame, and the virtue is will. In preschool stage it is initiative versus guilt, and the virtue is purpose. In school age, industry versus inferiority, and the virtue is competence. And then the 5th stage, that is in the adolescence, it is identity versus role confusion, virtue is fidelity. Then the young adulthood stage, it is intimacy versus isolation, and the virtue is love. Then generativity versus stagnation in middle adulthood, and the virtue is care. And finally, ego integrity versus despair in old age, and the virtue is wisdom. So the most commonly asked in exam is this stage, that is adolescent stage, that is identity versus role confusion, and the virtue is fidelity. Now coming to Freud's psychosexual stages, we all know that Freud proposed that personality develops through 5 psychosexual stages, with each stage that is centered on pleasure from different body regions. And if the conflicts are unresolved, there can be fixation and can influence the adult personality. So let's try to look at the stages one by one. The first is the oral stage, that is from around birth to 18 months. So the infant here, the organ of pleasure is mouth. The infant gains pleasure through sucking, swallowing, or biting. And successful weaning promotes stress, whereas fixation may lead to dependency, smoking, nail biting, or overeating. Now the second stage is anal stage. This is from 18 months to 3 years. Here the pleasure is focused on the bowel. So bowel and bladder control during toilet training. So harsh toilet training may lead to anal retentive personality, where the individuals have OCPD trait, that is overly neat and perfectionist, while permissive training may result in anal expulsive personality, where the individual may turn out to be messy and disorganized. The third stage is phallic stage, from around 3 to 6 years. The children becomes aware of their genitals, and the boys experience the Oedipus complex, and the girls the Electra complex, and the they identify with the same-sex parent, contributing to the development of superego. Then the fourth stage is the latency stage, that is from 5 years to puberty. here the sexual drives are relatively dormant. The energy is channeled into school, friendships, and development of skills. Then the final stage is the genital stage, that is from puberty and onwards. Here the sexual energy is directed towards mature relationships. And successful resolution of earlier stages leads to healthy adult relationships, independency, and emotional maturity. Moving on, Freud also proposed a structure of proposed two models of mind, that is a topographical model, which describes the levels of consciousness, and the structural model, which explains how the personality functions. So if you look at the topographical model, he divided the mind into three levels. Remember the iceberg theory. So there is the three levels of conscious, where we are aware of our currently aware of our thoughts and feelings. The preconscious level, where the memories and information can be brought into awareness, and the unconscious level, where it has hidden wishes, instincts, and repressed memories that influence our behavior without awareness. Now, the structural model, the Freud proposed that there are three components. That is the id, that is present from birth, operates on the pleasure principle. Then we have the ego. The id seeks immediate gratification. The ego develops later and follows or is based on the reality principle, balancing the demands of id with the superego, with the reality. Then there is superego, which represents our conscience and moral values, guiding behavior according to the societal rules. So when there is conflict between id and superego, there is anxiety, and ego reduces this anxiety using defense mechanisms which operate mainly unconsciously. Now let's try to solve few questions from this section. So conservation of number and volume is appeared in which Piagetian stage? Can you remember where is conservation coming? So it's in concrete operational stage. So pre-operational stage, egocentricity, sensory motor, what it is, object permanence. Okay. Now moving on to the next question. Which Ericksonian conflict characterizes adolescence? We have already discussed. What is the answer? Identity versus role confusion. Okay. So in this section, the stages of cognitive development by Jean Piaget and Erik Erikson stages, you have to revise that thoroughly the day before exam. It's very high yield. Now there's a quick scenario for you. A 4-year-old insists that a tall, thin glass holds more juice than a short, wide one, even after seeing the same amount being poured. So what is happening here? There is no conservation. He doesn't understand the concept of conservation. So which conservation develops in which stage? Concrete operational stage. So this is pre-operational stage. So the answer is pre-operational stage, where there is lack of conservation. Here the child is misled by the appearance and cannot reverse the operation. Now moving to the third section of our lecture. So beginning with language development. So language acquisition is a major landmark for cognitive growth. So language development follows predictable milestones in early childhood. So we all know that babbling begins around 6 months. First meaningful words appear by around 1 year. By 2 years, there is child usually combines two words like want, milk. This then further progresses to telegraphic speech, where the child uses short phrases like daddy, go work, omitting important words. So there are several theories which explain how language develops. So one is by Chomsky. Chomsky proposed that there is a language acquisition device that suggests the children are born with an innate ability to learn language. They have a universal grammar. But what did Skinner propose? Skinner believed that the language is learned through operant conditioning with reinforcement and imitation. However, this theory cannot explain the child's ability to produce novel sentences. Then Vygotsky emphasized that social interaction and language develops through communication with parents, caregivers, and people who are more knowledgeable than them. So children also can make predictable language errors. Overextension occurs when a single word is used too broadly. For example, a child describes all animals or calls all animals as dogs. Then there can be virtuous errors or over-regularization errors when the children apply grammatical rules consistently. For example, instead of saying "well," the child says "good." So these errors show that the children are learning rules than simply imitating others. So Chomsky proposed presence of a language acquisition device. And virtuous errors show that the children learn rules. They will not merely imitate the adults. Now, there are further more theories for language development. One is by Werner. Werner extended Chomsky's idea by highlighting the importance of the environment. So he proposed there is a language acquisition support system, that is LAS, which refers to the support provided by the parents and caregivers through talking, reading, and scaffolding language development. So this system, the LAS, complements the Chomsky's LAD by providing the social environment that is needed for language learning. So actually, Werner's theory complements Chomsky's theory. Another important concept is the critical period hypothesis that was proposed by Lenneberg. So Lenneberg suggested that language is most easily acquired before puberty, and the evidence for this comes from the curious case of Jean, a child who experienced severe language deprivation and despite immense training, never fully developed normal grammar or syntax after puberty. Now, another thing to add here is that bilingualism does not delay language development as it is commonly thought. In fact, it is associated with more cognitive benefits like improved executive function. Then code switching or alternating between the two languages is a normal feature of bilingual language development and should not be mistaken for any confusion. So Werner's last complements with Chomsky's lab. That is the innate capacity plus there is a supportive social framework that is needed for normal language development. Now, we have already discussed the key language milestones, which can be cooing around 6 weeks, babbling around 6 months, telegraphic speech. So I just wanted to highlight here is that babbling approximately around 6 months is universal across all cultures and even in deaf infants, which is an evidence that there is an innate basis for language supporting Chomsky's theory. Now coming to gender development. So gender development typically follows a cognitive developmental sequence. First is gender identity. So gender identity typically develops by around age 3, and the child can label their gender or can know their sex. But they still may think that if there's a girl child, the girl child may still think that she could grow up to be a daddy. And then there is the first thing in gender labeling, that knowing one's own sex. The second is gender stability, that is realizing that the gender is lifelong. This happens around 4 to 5 years. Then comes gender constancy. So gender constancy is when the child realizes that the internal gender remains invariant despite superficial changes in appearance or despite wearing the opposite gender's clothes. So there are two major theories that explain gender development. One is a social learning theory that proposes a child learns gender roles through modeling, imitation, and reinforcement. And then there is a cognitive theory that suggests that the children actively construct gender schemas which guide how they process information about gender. We also need to be knowing the difference between sex versus gender. So sex refers to the biological characteristics like the chromosomes or the reproductive organs, whereas gender refers to the socially and culturally defined roles, behaviors, and identities. Now, let's see a few more theories about gender development. So psychoanalytical theory proposed by Freud says that during the phallic stage, children resolves the Oedipus or Electra complex and identify with the same-sex parent, leading to the development of gender identity. Then social learning theory proposed by Albert Bandura argues that children learn gender-type behavior by observing the role models, imitating them, and receiving reinforcement from the parents, peers, or society. The cognitive theory emphasizes the child's active role. So, Kohlberg's theory states that children seek gender-appropriate behavior only after achieving gender constancy. And then Ben's gender schema theory says that children develop mental frameworks or what we call as gender schemas, which influence how they interpret information and how they guide gender-related behavior. Now, basic understanding of the normal child development is very important for the exam. So, you need to know the key developmental milestones. So, around 6 weeks, head control is attained. If you look at gross motor milestones, around 6 months, the baby can sit with support, can roll over. Around 9 months, can sit unsupported and crawl. Around 12 months, can stand, cruise, makes the first steps. Around 18 months, can walk well and climb stairs. Around 2 to 3 years, can run, kick, pedal, tricycle, etc. We come to fine motor milestones. Around 6 weeks, the baby can or the infant can fix and follow to midline. And around 6 months, she is palmar grasp, transference. Then around 9 months, there is immature pincer grasp and points. Then around 12 months or 1 year, there is mature pincer grasp. Then tower of 3 to 4, around 18 months, can scribble around this time. 2 to 3 years, Poppy's line and circle. Okay. Now, when we look at the social and language milestones, social smile is around 6 weeks. Around 6 months, reaches for familiar people. Around 8 to 9 months, stranger anxiety. Around 12 months, ways bye-bye. Then around 18 months, feeds self, imitates others. Around 2 to 3 years, interactive play or parallel play. Language milestones we have already discussed. So moving on to parenting styles by Diana Baumrill and Jacob Jacobi. So this Diana Baumrill's framework is frequently tested in exams. So it categorizes parenting based on two axes. That is demandingness or control versus responsiveness versus warmth. So how demanding the parent is versus how demanding or controlling the parent is versus how warm they are towards the children or how responsive they are towards the children. So authoritative parenting is associated with high demandingness, they are highly controlling, but high warmth or responsiveness is shown towards the children. Whereas authoritarian, they are highly demanding but low warmth towards the children. Permissive parenting, demandingness or the control is low, but the responsiveness is high. Neglectful parenting, both are low. So authoritative parenting is a gold standard. So these parents, they provide firm, consistent boundaries, but they remain warm and communicative. So the children born out of this parenting or children who are reared by this type of parenting, they have high self-esteem and good social competence. So this is the best type of parenting. In contrast, authoritarian parenting, they demand blind obedience because I said so, you have to do that. You cannot argue with such type of parents. So this often leads to withdrawn or anxious adults, or the children tend to be withdrawn and anxious. Permissive parents, they are very warm, but they do not set any rules. So this is also not good. The children reared by this type of parenting, they have lack of self-control and they tend to be very impulsive. Now the fourth type is neglectful parenting, which is low on both axes. It is associated with the worst developmental and behavioral outcomes. So you may often get confused between the terms authoritative and authoritarian. So it's a simple mnemonic that I use. Authoritarian, I attribute it to the parents, this type of parents tear the children apart. So it is not good. Authoritative is the best type of parenting. So authoritative parenting is associated with high warmth and high consistent demands. It's linked to the best child outcomes. Now, In this slide, I have added or highlighted some important genetic and neurodevelopmental conditions that are associated with autism and ADHD. So you need to focus mainly on the key association than memorizing a region. So Fragile X syndrome caused by FMR1 gene with trinucleotide CGG repeat expansion, and is the most common inherited cause of ID or intellectual disability. It is strongly associated with both autism and ADHD. In tuberous sclerosis, if we look at, it is due to the mutations in TSC1 or TSC2 gene and is associated with autism, epilepsy, and ID or intellectual disability. And we have Rett syndrome, which is caused by MRCP2 mutations. It mainly affects girls and presents with developmental regression, loss of hand skills, and autistic features. Then 22q11.2 deletion syndrome is linked with autism, ADHD, and later psychosis, especially schizophrenia. Then you need to know about the Angelman and Prader-Willi syndromes resulting from the abnormalities of 15q imprinting and may present with intellectual disability and autistic features. So Angelman syndrome, there is maternal deletion, whereas Prader-Willi syndrome, there is paternal deletion. Then finally, fetal alcohol syndrome, it's not a genetic syndrome, but it results from prenatal alcohol exposure. It can be associated with ADHD-like symptoms and even other neurodevelopmental difficulties. So let's try to look at or solve few questions from this section. So the innate language acquisition device was actually proposed by Chomsky, LAD. LAD is proposed by Chomsky. So Skinner is associated with operant conditioning. Chomsky gave the theory of innate language development. That is the LAD. Brodsky, you already know. Bruner gave LAS, language acquisition support system. Next question, which parenting style is associated with the best child outcomes? I hope you know, we already discussed, it is authoritative parenting. So, moving on. Now the fourth section for today's lecture, that is coming to the temperament and individual differences. So what is the concept of temperament? Temperament basically describes the biologically based style of behavior rather than why or what makes a child behave so. So Thomas and Chess, they identified there are 9 dimensions like rhythmicity or threshold of arousal, and they clustered all this into 3 main types. So they identified there can be easy temperament, usually around 40% of children show this type of temperament. There can be difficult temperament for around 10% children, and slow to warm up type of temperament is seen around 15% of children. And the most important concept here is goodness of fit. So we have to match the child's temperament to the environment. So easy child in a difficult environment may not be reared well. So I'll further explain this. So even if even a difficult child can thrive if the parents are very patient and structured, whereas the same child, a difficult child, may develop behavioral disorders in a chaotic or highly critical environment. So, and research also shows that the temperament is moderately stable over time. That is, a child who is naturally shy may tend to retain these traits into later life. Okay. Now this slide highlights the important concepts in the development across adulthood, aging, and family functioning. So adulthood, we will see the Levinson's stages. He proposed that adulthood progresses through a series of seasons of life, and the key stage is midlife transition, occurring around 40 to 45 years, where the individual may reevaluate their goals, relationships, and achievements. So this is a normal developmental transition. This is not a crisis. We will again discuss the Levinson stages in the coming slide. Now, as people age, the different aspects of intelligence changes differently. So you may be familiar with the terms crystallized intelligence and fluid intelligence. So crystallized intelligence is simply the accumulated knowledge and the life experience. So over the time, as the individual ages, this is preserved. The crystallized intelligence is preserved, or it may even improve. Whereas fluid intelligence involves problem solving or processing speed or the ability to learn new information. So this fluid intelligence tends to decline as individual age. When Camberwell family interview, you may be well aware it is used to measure the gold standard instrument that is used to measure high expressed emotions within the family, like criticism, hostility, or emotional over involvement. And families also progress through predictable life cycle stages like marriage, parenting, or children leaving the home and later life, with each stage presenting unique developmental challenges. So let's try to see these theories one by one. First is by Daniel Levinson. He proposed a developmental theory consisting of universal stages that extends from early infancy to the elderly stage. So this is an age-based theory more than an event-based theory. It was based on the biographical interviews of around 40 men from America. He proposed 5 stages: pre-adulthood stage, early adulthood, middle adulthood, late adulthood, and late adulthood. And there are transitional periods, if you can observe there. So there is pre-adulthood is from 0 to 22. And there is a gap of 5 years. Early adulthood begins from 17 to 45. So there is a gap of around 5 years. That is called a transitional period. Now, the next theory is by George Valiant, who extended the Harvard Grant study, which followed healthy men over many decades to identify what are the factors that are associated with successful aging. And what did he find? So he found that mature defense mechanisms like humor, altruism, or suppression and sublimation, they are better predictors of mental health, satisfying relationship, and they are better predictors of successful aging. So the key message is that, according to Valiant's theory, is that how we cope with stress is more important than the stressful events themselves. So coping is really important. Now the third theory is by Roger Gall. Roger Gall proposed that adulthood is a process of psychological transformation. So when the individuals mature, they gradually let go of unrealistic beliefs that they have acquired from childhood. For example, as a child, you may have a belief that my parents are always right, or someone else will solve my problems, like a damsel in distress. So we let go of these unrealistic beliefs as we grow into adults. So this process helps the adults to become more independent, autonomous, and emotionally mature. So unlike Levinson, who focused on the life stages, Gall focused on changes in beliefs and thinking during adulthood. So we also need to distinguish between normal derailment from pathology. So the Bowlby or Parks model is more commonly tested for its description of fawning and pining, where the bereaved may experience illusions or pseudo hallucinations of the deceased. Then we also need to know about the Kubler-Ross stages. We actually provide this framework for terminal illness, but it is also applied for a general loss. These are not rigid linear stages, and the individuals may often oscillate between the stages. When ICD-11 added a new disorder, that is prolonged sleep disorder, when the symptoms persist beyond 6 months and cause significant socio-occupational impairment. So the models of these, Bowlby-Parks model, there is a progression from numbness, earning, disorganization and reorganization. And Kubler-Ross model, it is commonly abbreviated as DABDA, denial, anger, bargaining, depression, and acceptance. And prolonged grief and persists for more than 6 months. Like I mentioned, the stages are not rigid stages, so people can oscillate back and forth. Now, coming to the psychology of aging. So, as I've already discussed, as we age, we see a decline in the fluid intelligence, like processing speed or memory, while the crystallized intelligence is well preserved. So let's try to solve few questions from this section. The Camberwell family interview is used to measure. Look through the options. Yeah, the right answer is expressed emotion. A flexible, adaptable infant with regular routine fits into which temperament category? Can you answer? BC. Yes. So go through the types of temperament developed by Thomas and Chess. Now coming to the final section for our today's lecture, that is neurodevelopmental disorders. The neurodevelopmental disorders, they are defined by the early onset. They arise very early in life and they are characterized by a persistent phase. So we all know about ADHD, where the symptoms need to be present in at least two settings, like the home and the school. Then ASD, which is now considered as the autism spectrum, which even includes Asperger's. So a core cognitive theory in ASD is a theory of mind. I'll discuss it in the coming slide on ASD. And intellectual disability. So theory of mind, to understand it better, have you heard of the Sally and Annie experiment? If not, please read it. It's a very important thing that we need to be aware of. So in this Sally and Annie experiment, they identified the theory of mind, or the concept of theory of mind. So it is said that most children develop theory of mind by around age 4, whereas children with ASD, they struggle to realize that others can hold false beliefs different from their own reality. So they cannot think in others' shoes. That's due to theory of mind deficit. Now let's try to see details of each of this. So coming to ASD, autism spectrum disorder, it's a neurodevelopmental disorder that is characterized by persistent difficulties in social communication. There is restricted and repetitive patterns of behavior. And there are three core features: the social communication and interaction deficits, such as poor eye-to-eye contact or difficulty understanding the social cues, or there is reduced social emotional reciprocity. So if we smile at the child may not smile at us back. And there can be restricted and repetitive behaviors like stereotype movements like hand wringing, or flexible inflexible adherence to routines. So they dislike their routines being changed. They may have restricted interest or fixated interest. For example, they may turn up the cars upside down, play with the wheels, and they may have sensory sensitivities where they may be hyper or hypo-responsive to sounds, touch, or other sensations like lights or textures. So the epidemiology of ASD, when we look at it, it approximately affects around 1 to 2% of the population, with a male preponderance. The male to female ratio is around 3 to 4:1. And ASD is often missed in girls. Usually in girls it is diagnosed later, or it is underdiagnosed because they may camouflage their symptoms. And as I discussed, two main cognitive theories are considered when we try to explain the ASD spectrum. One is a theory of mind deficit, that is the difficulty to understand other person, what the other person is thinking, or what the other person believes, or what the other person feels. So this is demonstrated by the classic Sally and Annie force belief test. The other theory is the weak central coherence theory, where there is a tendency to focus on details and seeing the overall picture or big picture. So these children will focus on the details instead of seeing it as a big picture. The common comorbidities that are associated with children having ASD are ADHD, intellectual disability, and epilepsy. So please read about the concept of theory of mind, and most importantly, the experiment, the Sally and Annie experiment. Coming to the next neurodevelopmental disorder, that is ADHD, or attention deficit hyperactivity disorder. It's a neurodevelopmental disorder that is characterized by persistent patterns of inattention and or hyperactivity and impulsivity that may impair functioning, and the symptoms should be present in at least 2 or more settings, and the onset is before the age of 12 years. And the two symptom domains are inattention That is difficulty in sustaining attention. The child may be easily distracted, may have forgetfulness, poor organization skills, may be very messy and disorganized. And there can be hyperactivity and impulsivity. The child may fidget excessively, have poor sitting tolerance, may talk excessively, interrupt during the class, may be very impulsive, act without thinking through the consequences. The symptoms, as I told, should begin before 12 years of age and present in at least 2 situations and should cause socio-occupational functioning impairment. And epidemiology, if you look at it, it affects around 5% of children. And again, there is need to difference. The common comorbidity associated with in children with ADHD include oppositional defiant disorder or ODD and conduct disorder, or SLD or specific learning disability disorders, tic disorders, including Tourette syndrome. So the neurodevelopmental disorders, as we know, begin in the early childhood and can co-occur and are more common in those. So here is a table summarizing the key neurodevelopmental disorders. ADHD, the symptoms are inattention and hyperactivity or impulsivity. ASD has social communication deficits and repetitive stereotype behaviors and restricting interests. Intellectual disability, the IQ is below 70, with deficits in adaptive functioning as well. In SLD, there can be difficulties in reading like dyslexia or difficulty in mathematics like dyscalculia despite normal IQ. Now, tic disorders, the most common is Tourette syndrome, which is a complex tic disorder where there is a presence of both motor and vocal tics. And then there can be developmental coordination disorder where there is poor motor coordination, which affects the child's ability to do the day-to-day activities. Moving on, common childhood emotional disorders, especially the anxiety spectrum, involve separation anxiety, where the child has excessive fear of separation from caregivers. Then there can be school refusal, where the child refuses school due to anxiety but not fluency. Then the important genetic syndromes that we need to read are Down syndrome, Rojina syndrome. So Down syndrome, the individual may have intellectual disability, developmental delay, and early onset of Alzheimer's. Rojina syndrome usually presents with self-injurious or self-mutilating behaviors, and is associated with HGPRT deficiency. The enzyme is HTPRT. Then there can be attachment disorders like reactive attachment disorder and disinhibited social engagement. Now, the landmark adverse childhood experiences study proved that childhood trauma has a dose-response relationship with all the major adult health outcomes, not just mental health, but also physical health conditions like heart disease or cancer. And children are not merely damaged by trauma, but their resilience can be fostered. The most important protective factor is the presence of a simple, consistent, and a supportive adult. Even if it is not the parent, the presence of one supportive adult who is constant is very important. Who can buffer the psychological toxic stress response. Moving on, disruptive and attachment disorders. So, oppositional defiant disorder involves persistent, defiant, argumentative, and hostile behavior towards the authority figures without serious right violations. So, there is no violation of rights of others. That's the difference between ODD versus conduct. So, conduct disorders is more severe. It involves aggression, breaking or destruction of the property, rule breaking, decide, or it can even progress to ASPD. Attachment disorders include, as I discussed, reactive attachment disorder, where the child is withdrawn and inhibited and avoids comfort, and disinhibited social engagement disorder, where the child shows indiscriminate friendliness and lacks. The child may be very comfortable around strangers. So, adverse childhood experiences show which relationship it later rehearsed. As I discussed, a dose-response relationship. Self-mutilating behavior with hyperuricemia in a boy suggests Rojina syndrome. Now there is a quick scenario for you. A 5-year-old child has marked difficulty with reciprocal social interaction, lines up toys repetitively, and is distressed by change. So has difficulty adapting or has a strong adherence to routines. That's why the child is distressed to change. Has peculiar interest and repetitive behavior is there. And reciprocal social interaction is difficult. So this classically describes a picture of autism spectrum disorder. In which Piagetan stage is object permanence occurred? Can you try to answer? These are the options. So the correct answer is sensory motor stage. So object permanence, that is knowing when the object can exist even if it is out of sight, is called object permanence. It can develop during the sensory motor stage. Which attachment pattern shows distress on separation but is difficult to soothe on reunion? Can you try to answer? Yeah, the answer is insecure ambivalent type or anxious ambivalent. So they are highly distressed by separation, but the mother or the primary caregiver cannot calm the child during reunion. So just to add here, never equate attachment with feeding. That is proposed by Harlow. Then, remember the Harlow's experiments. The rhesus monkeys prefer contact comfort over feeding. Never expect conservation before concrete operational stage. The conservation is developed only in the concrete operational stage, not before. Do not confuse privation versus deprivation. So deprivation is proposed by maternal, deprivation is proposed by Bowlby, whereas privation, yes. Now, never assume temperament alone predicts adjustment. It always match Piaget stages to its cognitive hallmark. Pair Erickson stage to the life phases. Authoritative parenting. Again, I stress authoritative has the best outcome, and adverse childhood experiences have those related later morbidity. So these are the final slides. You can use as cheat sheets for your exam. So contact comfort more than food, Harlow. Strain situation proposed by Mary Ainsworth. The concept of monotropy and maternal deprivation by Bowlby. Imprinting in critical periods listed by Conrad Lawrence. Separation individuation theory by Margaret Marler. Commonest attachment type, around 65% is secure attachment. Object permanence is in sensory motor stage. Egocentrism in pre-operational stage. Conservation in concrete operation. Abstract reasoning and hypothetical deductive thinking in formal operational stage. The moral stages were proposed by Kohlberg. Remember, it has 6 stages divided into 3 levels, and only 15% of individuals go into the post-conventional level. Identity versus all confusion is a hallmark of adolescence by Erickson psychosocial stages. Now, language acquisition device is the theory proposed by Chomsky. Virtuous errors suggest the rule learning than the children merely observing or imitating the errors. Then first childhood outcome, as I already told, authoritative parenting. The temperaments by Thomas and Chess, 3 classes. Goodness of fit theory. Then expressed emotion is measured by Camberwell interview. Then there are various neurodevelopmental disorders like ADHD, where there is inattention and hyperactivity impulsivity. And then in autism, there is social deficits and the repetitive restricted behaviors. Then IQ less than 70 and adaptive deficits in IDD or intellectual disability. Then self-injurious behavior and hyperuricemia links with Leach-Lyon syndrome. So this brings us to the end of today's lecture. So I hope this was clear for you. If you have any doubts, please feel free to reach out. And this is a very small topic, but I stress again all of you to go through the Piaget stages and the Erickson stages the day before your exam. It's very highly. Thank you all for your patient listening. Have a nice day. And all the very best for the upcoming exam. I know it's just in 3-4 days. All of you will do well. Thank you. Thank you so much.